Tonight on News 5 Live, COVID-19 patient number 8 identifies himself as 50-year-old land inspector Ransley Gillett from Corozal. Director of Health Services says none of the primary contacts for patients 6 and 7 tested positive for COVID-19. The Compol has identified the 3 cops who coerced the Belicity man and a mentally ill woman into having sex on camera. Government threatens LPG importers over emergency discounts to Belizeans during the COVID-19 crisis. And a Belicity family turns stationaries into protective face shields for frontline workers. Details of these stories and more coming up in tonight's newscast. Good evening. Welcome to News 5 Live for Wednesday, April 8th. I am Marlene Cuellar. There is a most worrisome report coming out of the region tonight. Heads of government of SICA met in March and adopted a regional contingency plan to combat the novel coronavirus. A release from SICA says that the region is benefiting from 180,000 testing kits from the Republic of Korea, which is one of the region's strategic partners. But according to the release, all SICA countries accepted the donation with the exception of Belize. Yes, Belize. The kits are described as being 99% accurate and compatible with those used in Central America. We tried to reach the Ministry of Health for an explanation, but no one was available at this time. We do note that on Tuesday, Director of Health Services Dr. Marvin Manzanero said that 15,000 kits were ordered and 3,000 were on the way. Today, however, he said that Belize is running low on the viral swabs. And there will be an increase in sampling and testing countrywide, especially in the Cayo and Corozal districts for the COVID-19 virus. However, supplies such as swabs to collect samples are running low. This will restrict the amount of testing that Belize can do, but according to Director of Health Services Dr. Marvin Manzanero, officials here are working with PAHO to acquire a batch of viral swabs as early as next week.
Just like in the regions, we are running low on the viral swabs, which is a little specific lab equipment that you use to be able to take a viral swab, and we're trying to outsource that. We had thought we could have gotten a batch next week. We are working with the PAHO regional office, but all countries are having a difficulty in terms of accessing that those viral swabs.
There is a second confirmed case of COVID-19 in the Corozal district. The patient is Ramsey Gillett, a brave public officer who works at the Lands Department in Corozal town and resides there with his wife and 2 children. Gillett's sister, during the course of this afternoon, provided details on Gillett's identity as a means of ending the stigma on the victims of the virus. So has patient number 6, a businessman from San Ignacio, who's also spoken publicly about the illness, calling for an end to the discrimination. Gillett is a 50-year-old diabetic who he first sought treatment at a private facility and was referred to the Corozal Community Hospital. Given the turnaround, and it was not until Tuesday that he was finally tested. Here is News 5's Dwayne Moody with this report.
Patient 8 is 50-year-old land inspector of the Ministry of Natural Resources, Ramsey Gillett, who is attached to the Corozal branch of the Lands Department. Gillett lives in Paraíso with his wife and 2 children. He is the second person to test positive in that district in 4 days. On Saturday, a student was the 5th confirmed case overall for the country, and the patient remains in quarantine.
A well-known gentleman within the town, and I believe within the whole country, as we all know, he's a very respectable guy and a very friendly guy. It's really an unfortunate situation for him, his family, and for Corozal. But it just shows that this virus has no respect for anyone.
In a social media post by his sister on his behalf, Gillett preferred his personal advice in respect of the health system and called for understanding to wipe away the stigma associated with COVID-19 patients. It says, quote, "Please afford prompt and courteous service to all who make an outreach and attempt to engage the public health services. My experience could have been different," unquote. He accessed the private medical facility in that northern municipality on Saturday, complaining of fevers and headaches. He was checked and referred to the Corozal Community Hospital, but we are told he was denied testing because he did not qualify. His condition did not improve, and he returned to the private facility. He was again provided with antibiotics and referred to the community hospital, and after some calls were made by relatives, Gillett was finally swabbed and admitted to the public hospital on Tuesday. By 7 o'clock this morning, it was confirmed that he had contracted COVID-19.
In terms of the patient we detected yesterday, it's a 50-year-old male. He has one precondition. He's a diabetic. He was swabbed. He doesn't really have respiratory symptoms now, but he did refer having had respiratory symptoms, being seen at a private facility, being treated with antibiotics in a private facility. So when he came into the health system, it's because he was having minor respiratory symptoms, but primarily abdominal pain and diarrhea.
But is patient 8 an imported case? Gillett says that he had not traveled recently, but believes that his line of work may have made him exposed. So if it is that he didn't travel recently or come in contact with another confirmed case, is it then a community spread? Did he pick up COVID-19 from someone within the community who does not know that he or she is infected?
He doesn't have a travel history that much we know, other than being across the border, but no travel history to the U.S. So we'll have to determine in the mapping exercise where he could have potentially become infected, and that exercise started very early today.
I would have to allow the Ministry of Health to do its mapping so that we all know and are very aware of where he got infected from. No, I don't believe it's from Corozal, but it's all up to the mapping that the Ministry of Health will do.
At this time, the prognosis is good for Gillett, who remains hospitalized in a stable condition.
The patient is stable. I just checked before I came on. He's with no respiratory symptoms. He's without any oxygen, and he is saturating at 96% without any supplementary oxygen, with no respiratory condition at this point in time. So that patient is being managed at the Corozal Community Hospital in the isolation area, away from the routine Corozal Community Hospital patient set.
Corozal Mayor Rigoberto Veo says that going forward, the contingency plan remains intact with further enforcement.
It's up to us now to defend our brothers and sisters out there. No? This is the time when we need to respect the curfew more than ever, and we need to work together with the police department and the leaders and officials who are working to make sure that this country stays free from this virus as much as possible.
Dwayne Moody for News 5.
Mapping and testing of other persons infected by the virus continues by the Ministry of Health. On Ask the Experts today, Director of Health Services Dr. Marvin Manzanero provided an update on patients 6 and 7 and shared the test results for patients 1 and 2 are due tonight or early Thursday morning. Dr. Manzanero says that the primary contacts, which include family members of patients 6 and 7, have turned out to be negative for the novel coronavirus. Patient 6 remains in self-isolation in Cayo, and patient 7 remains hospitalized at the KHMH. Both patients, according to Manzanero, are considered stable.
None of the immediate family members or primary contacts, as you would call them, or close contacts of patients 6 and 7 turned out to be positive for SARS-CoV-2, the disease we now know as COVID-19. Nonetheless, these family members will have to wait out the quarantine period at wherever they are, because none of them are tested positive. The patients 1 and 2 were swabbed yesterday. Those samples will go in today for testing. So we should have results throughout the course of the night into the early hours of the morning. Patient number 7 also was, we checked upon him. He's not intubated, has not required intubation. So they are both considered to be stable for now, being managed at 2 different facilities. And well, you know already, we had given you the update on all the other patients being managed either in a quarantine area or being kept in isolation at home. So tomorrow we should know the results of patients 1 and 2. That's the first of 2 negative. They would have to have 2 negative tests before we are declared. We can declare them that they have gone through the process and are considered to be recovered.
And so now there are a total of 8 Belizeans who've tested positive, and it is expected that the number will increase in the days to come. While the hope is that COVID-19 patients will recover, it is not accurate to say that they would be cured. The New York Post reported on Tuesday that at least 51 patients diagnosed as having recovered from the virus in South Korea have tested positive a second time after leaving quarantine. Those who have recovered are still contagious, as are persons who are asymptomatic. Health officials here are still trying to determine if there is a case of a community spread.
If recovered, can someone contract again? We are seeing evidence that that seems to be the case. We have to wait for more evidence to see whether that, in point of fact, is something that happens, and how often that can happen, and how more severe the case can be, because we're seeing that some are saying that it's more severe in a second. But again, that's evolving information in that regard. Can we now see clearly and definitively say that we have community spread? Clearly and definitively is a very strong words. It seems to indicate so. The mapping exercise that we will complete with patient number 8 would guide us to that. Because it's not also how they became ill, it's how the potential of them having infected others, and who are the asymptomatic carriers that have not sought or will never seek medical attention. I think that's something that our mapping exercise today for patient number 8 will be able to say.
Turning to the despicable sex video in circulation, 3 officers, including a corporal, have been identified as the policemen behind the most appalling act of sexual coercion that was recorded and disseminated on social media earlier this week. The trio was on duty in Belize City during the early hours of Monday morning when they encountered a man and a woman near an abandoned building on Central American Boulevard. Accusing them of having just had a sexual encounter, the officers forced the pair into performing a sexual act against their will, goaded them while recording the episode before releasing the video online moments later. It's utterly disgraceful and revolting, to say the least, and has brought the Belize Police Department under intense public scrutiny at a time when the law enforcement agency has been tasked with maintaining law and order during the countrywide state of emergency. Commissioner of Police Chester Williams has swiftly investigated the matter and has since been able to determine the officers responsible for the incident.
Since yesterday, I have been following this matter. I have spoken to both persons, and they felt comforted speaking to me about it. And having interviewed both of them, I am satisfied that the persons behind the video are indeed police officers. I have done additional follow-up. I was up from early this morning following up on this matter because I need to know who the police officers are. And I'm pleased to say that we have identified the 3 police officers involved. At this time, 1 is in custody. The other 2 resides in the Orange Walk district. I have spoken to the officer commanding Orange Walk, and I believe by now they should have the other 2 or about to have the other 2 in custody. Let me make it emphatically clear that we are going to leave no stone unturned to ensure that those 3 idiots are dealt with, and dealt with swiftly. Hopefully by the end of the day today or tomorrow, we should be making an arrest. The only difficulty we're having at this time is that, as you would know, there are a group of persons who may have some connection or influence over the 2 individuals.
According to Campbell Williams, the despicable act perpetuated by the officers undermines the work of the police department, as well as the individual efforts of their colleagues in shaping the image of the department. The male victim, he says, was innocent to the situation because, like the woman, he was also under duress.
I have seen the video, and it is perhaps one of the most disgusting things I have seen. And I cannot imagine what could have possessed those persons who are behind that video to have done so. It is already bad to force two people into sexual activity against their will. It is 5 times worse to video record it, and 10 times worse to share it publicly. Words cannot describe how I feel. And when people think that they are outraged and we are not, I want to say to them that that is far from the truth. The video do outrage us. After all, I'm sure that the public will appreciate the fact that, for the most part, police officers are good people. And every day we have police officers out there putting their lives on the line for the safety of others. Every day police officers are doing heroic acts. But when we have idiots like those behind the video doing what they did, it just puts a cover, a damper on all the good work that we are doing. I want to give the public the assurance that we are doing what we can. I have assigned ASP Martha Reese, who is one of our experts, or may I say, our most senior expert in sexual cases. The male is an innocent agent. He was being coerced, as I said, by people with authority, officers of the law. And I can say to you that from both accounts, the male and the female, they have said that there was no actual penetration. But notwithstanding that, from what I'm seeing, it could be a possible case of attempt rape and conspiracy to commit rape.
The officers involved have been identified as a corporal and 2 police constables. Notwithstanding the tendering of his resignation a week or so ago, Campbell Williams will be withdrawing that notice of departure from the corporal in order to have him face internal discipline for his actions. The other 2 men of lower rank are from Orange Walk District.
From what we know so far, one of the individual is a corporal. He has served this department, I think, from 2008, which will give him 11 years. And he is supposed to be a mature individual. May I say that he have also, about a week ago, tendered his resignation from the department. That resignation has been accepted. But I'm going to rescind that resignation acceptance. And then we're going to deal with him through our disciplinary process for this matter. And then the outcome will determine if he resigns or he is dismissed.
The Ministry of Health has also weighed in on the issue, saying that its mental health unit recognizes one of the victims as a person with a severe mental disorder. The ministry says it is appalled at the assault on human dignity and is dismayed that these persons felt comfortable enough to record and share the video. The ministry also calls on human rights actors to denounce the violation of the rights and dignity of mentally disabled persons and to strongly advocate for the most severe punishment to be levied against the violators. The public is also asked not to share the video so as to reverse stigma, discrimination, and victimization of vulnerable persons. Coming up, we'll hear more from the San Ignacio businessman Nigel Espat, known as patient number 6. The sixth confirmed case of COVID-19 is a San Ignacio businessman, Nigel Espat, who says he's recovering from the virus. Espat spoke to News 5 on Tuesday evening, and this morning he described in detail his condition on Open Your Eyes. He was diagnosed on April 6th and has not required medication. Espat is a type 2 diabetic, but says he's not suffering from the common signs and symptoms. Among the symptoms Espat first experienced is a loss of his sense of smell and taste. He remains in self-isolation at his home in San Ignacio town, and via phone he said that the extensive mapping has commenced to determine if any of the persons he had direct contact with, including his Belize City employees, were infected.
I believe that I contracted it from patient number 4, who is Hubert Piper. Hubert was a very close friend of mine, and he rode with me on average maybe 2 or 3 times a week in my vehicle from San Ignacio to Belize City. And so the likelihood is that that is where I might have gotten it. I try to stay inside my house. I've been wearing this mask 24 hours a day, and that is very uncomfortable to have it on. Just try to keep as much distance between me and my family as we can. No? The mapping is very extensive. We also try to remember everyone that we've come in contact with lately. So they did do swabs of all of my close contacts here in San Ignacio, which would be my direct family, my parents, and I had contact with them and some other people. No? Then there's also my employees in Belize City. They were tested yesterday, and some of those results have already come out today that they have come out negative.
Do you have any pre-existing condition?
I have type 2 diabetes, and I'm a bit overweight, so that puts me at a disadvantage and perhaps makes it easier to contract it. No?
But at the moment, you're not experiencing any respiratory difficulties?
No, I haven't had any respiratory problems, any at all, for the entire duration of this thing. Even now, and I'm actually feeling a lot better today than I was yesterday.
Nigel Espat is expected to be retested early next week to determine if his body has been able to dispose of the virus. He will be retested twice, according to health officials. The businessman says he has been keeping a positive mind, staying away from negativity, and encouraging an end to stigma and discrimination. He says that while COVID-19 is not a death sentence, he's urging Belizeans to follow the advice and take the threat seriously.
I understand that there were some things that I already posted on social media, some very negative things, a lot of them based on speculation, and so I don't want to indulge in any of that. I'm listening to the news, and there's one thing that concerns me about this entire thing is that there seems to be growing stigma about it. And I think my case, perhaps, is a good example that it is not a death sentence. It is not a death sentence. That the majority of people do recover. It is important that everyone takes precaution, especially right now we need to curb whatever spread might be out there. But on a whole, I think perhaps the media needs to highlight as well that there are many people who are recovering from this thing. And it's not an automatic death sentence, so people need not panic.
You know, there's a lot of fear when it comes to COVID-19 and contracting the disease. What do you want to tell Belizeans, those who are staying at home, adhering to the regulations, and even those who are not taking it seriously?
Well, I think people should take it seriously. I think they do it. The thing is that, like I said, it is not an automatic death sentence. And my case shows that I am feeling, health-wise, I am feeling fairly well. I have been feeling fairly well except for the sinus problems. However, no one knows if they will get mild symptoms or severe symptoms. There is a contrast between me and Hubert. Hubert is no longer with us. His symptoms were severe.
Tests conducted on some family members, including his father, have returned Tensions are decreasing between the Nurses Association of Belize and the Ministry of Health. Both parties met today to discuss concerns brought up by the association related to the equipment for frontline workers who are at risk of contracting the COVID-19 virus. The association says that Belize's health system is not prepared for the COVID-19 pandemic, not in infrastructure, materials, or personnel. Nurses' requests continue to go unresolved up until today, when the association leaders met with top officials from the Ministry of Health. The association complained that there is not sufficient protective equipment for the staff, that transportation to and from work proved to be a challenge, and putting themselves in isolation because of their career has added to their financial burden. President of the association, Daryl Spencer, says that several of the concerns have been addressed.
The ministry holds the position that they don't see necessary for the entire staff participating in the flu clinic and COVID-19 program needs to be fully attired when it comes to a complete bodysuit, face shields, mask and glove. The association still believes that that would be the wise thing to do, but the government, the ministry thereby is acting on what is recommended only. When it comes to the allowances, we said that the Labour Commissioner and the CEO of the Labour Department are going to see into what's the position of the allowances that we had requested and what is the timeliness or what is the enumeration there that will be given. I'm supposed to expect an update on that by this evening, and then only then will I be able to see what final position on that. No? The transportation was arranged. I want to hope that the ministry will hold true on that, where it concerns getting the staff to and from work, be it in between the districts.
According to Daryl Spencer, communication between both parties will continue in the days ahead. As for the flimsy tents used for the COVID-19 areas and hospitals countrywide, Spencer says that the ministry has begun replacing the tents with wooden structures.
Corozal, Bermopan, and San Ignacio to date have received one such wooden structure to replace, I guess, one of the tents, and we will be working towards see if we can get all the little tents replaced. Of course, it's a work in progress. The promised held to commitment was Dangiga will be receiving their wooden structure in the next week, and the week thereafter, Punta Gorda should receive their structures. I want to believe again, I want to hope that we can hold them to that commitment, and so in the next week or two, we can update you on whether or not the ministry made good on those promises.
There is news tonight which public officers will not be happy about, and that is because those members expecting salaries today for the April 15th pay period are not getting their money until April 14th. That is 6 days late and after the Easter holidays, during which families will be staying at home and will need to stock up on food and other items. It is also the first salary for the new financial year 2020-2021. The delay, we are told, is due to the economic downturn and because government's revenue is low as it battles the novel coronavirus. The Lord Ashcroft COVID-19 Relief Fund has made another donation. This time, it is befitting Hope Haven Children's Home and Community Center located on Ambergris Caye. The donation is in the amount of $100,000. The money will be used for the delivery of essential grocery items to families that have been affected by COVID-19. On Ambergris Caye, a significant percentage of the families depend on tourism, but that sector has come to a grinding halt due to the suspension of flights and cruise ships, as well as the state of emergency. The money will ensure that the food program continues and extends to affected families. To date, Hope Haven has assessed 1,125 families, and over 1,000 of them have received supplies. 400 other families are waiting to be assessed. Distribution of groceries will continue through April, and the care bags will include other items such as meat, poultry, eggs, oatmeal, tuna, peanut butter, pasta, and canned goods. Recently, Lord Ashcroft donated $10 million to the government of Belize to assist to weather the economic downturn caused by the virus. After the break, LPG importers say government is threatening to close them down. Government and the LPG importers are sparring again. 3 of the 6 liquefied petroleum gas companies in Belize, namely Belize Western Energy Limited, Gastomsa, and Southern Choice Butane, or Zeta Gas, are at odds with the government for threatening to confiscate their inventory and essentially take them out of business for non-compliance. Back in November of 2019, government passed a statutory instrument preventing LPG companies from controlling butane prices. The prices are now fixed. So when the companies offered a promotional rate for butane for the month of April to its consumers during the COVID-19 economic hardship, the Bureau of Standards fired off a letter to the importers threatening their operations. Attorney Audrey Matura is one of the counsels representing the LPG importers, and today called a press conference to spill the beans on what's happening.
With what consumers have to use are offering their own relief. So what is wrong with the LPG companies offering their own relief? On the 1st of April, they launched their promotional prices. And in their promotional prices, they reduced the price of butane gas because they can do it because the world market is lower. As a result of that, the Belize Bureau of Standards, which is the one that deals with control prices, called Mr. Bautista, threatening him that they can go and take away their inventory. But since then, yesterday, they also sent letters. They sent letters to the other companies threatening them. We gave you all copies of those letters. We are therefore saying that that is unjust. This is the opposite of what you all had. When COVID crisis really set in here in Belize, what some of the stores were doing was price gouging. These companies, what are they doing? They're saying, look, the same way we know that the world market is lower, it is just right that we transfer these benefits to the consumer. The government has, by letter, sent to our clients indicating to them that the license to import LPG will only be granted to them up to the 30th of April. So come the 1st of May, the new company should be performing. That's the expectation.
The Bureau of Standards regulates the retail price of butane, but not the wholesale price. It is the importers and wholesalers who control that. World oil prices have been plummeting due to COVID-19, and the importers who source LPG from Guatemala, Honduras, and El Salvador say they're trying to transfer these benefits to consumers. So why would the government intervene? According to Prime Minister Dean Barrow at a House meeting back in August 2019, the purpose of the National Gas Company Limited Agreement is to ensure that the price of butane is reduced and that the Mexican-owned companies cannot hold the country at ransom. Attorney Audrey Matura alleges that politics is at play, in which government is trying to protect the interests of the National Gas Company, which will, when construction is completed, have the monopoly in importation of LPG.
As you all know, the government has passed a legislation that creates a monopoly that the government is part of it, and it's called the National Gas Company. For them, their projections to work and for them to make the millions they hope to make on the backs of consumers, it is in the interest of the government to keep prices high. And do the maths of it. If the prices are high, just think about what is the real cost of the LPG that new monopoly will be spending, and what is the profit margin. But if these companies are being penalized for lowering prices, it is really the politics of money and power that's at play. And that's one issue we are prepared to show you all the figures so that you understand that sadly in this fight for the government to create a monopoly and to keep prices high so that they and their partners and cronies remain in a position to make a lot of money, they cannot make the consumer in this country know that the prices of LPG worldwide has reduced and that the consumers deserve that reduction. That's what the fight. The elephants are fighting, and you, the consumers, are being trampled. And so our client has asked that we do this press briefing because they believe it's their social duty to let the consumer know. And for the position of our clients is that they have no problem with the new company forming and operating. All they want is there to be competition in the market. It's a free market. We're a democracy. We're not China, and we're surely not any of those states like Russia that the state controls everything. That's what they want us to go into. When you have a state-owned company along with some private sector, select private sector, wanting to create a monopoly, because that's the real monopoly. But they did reverse psychology and say, our clients are monopoly. There's 6 importers of LPG right now. Our clients only happen to be 3 of them. So what they're doing is that they're making sure that they're protecting their self-interest and using the power of the state.
2 lawsuits have been filed in respect of the matter in which the importers are seeking judicial review of SI 57 of 2019 and a constitutional challenge against the government. According to attorney Audrey Matura, on behalf of the LPG importers and along with co-counsels Dean Molina and Jose Alpuche, they're challenging the power of the government to infringe the constitutional right of their clients to conduct business.
In terms of the court aspect, the case is a judicial review case. We are reviewing how the government went about making a decision to put fixed prices instead of controlled prices. Bureau of Standards can control prices. They can tell you can't sell beyond this price, but they can't tell you can't sell below this price. That's our theory. They did pass legislation that says that they can confiscate the inventory. That legislation, we are challenging it. 2 legislation makes provision for that. In the fixed price legislation, which is SI 57 of 2019, and we're also challenging SI 80 of 2019, in which at Section 8, they say the minister, he can just decide he will take away a product. That has nothing to do with the state of emergency. Nothing. Those were legislation passed before we knew COVID was coming here. Those were legislation passed before there was a state of emergency. The caveat I must add to that is that even if those legislation did not exist and there is a state of emergency, under a state of emergency, Section 17 of the Constitution that gives you right to property can then be curtailed or suspended, and the state can take over different business, not only LPG, they can take over the supermarkets, the production of rice, flour, everything. Our state of emergency is not at that level. There is no danger that LPG will not be coming into this country. As a matter of fact, under the state of emergency, the government made it clear that all ports remain open for importation and exportation. Our clients, they get licensed to import LPG through Guatemala. All the companies import through Guatemala. For several reasons, it's the cheapest route, environmentally it's the best route, and economically it then affords good prices. There's a second case before the court right now, and it's a constitutional case which we just filed yesterday. Well, today's Wednesday, sorry, which we filed Monday, in which we are challenging the power of the government to infringe the constitutional right of our clients by saying that we will stop you from carrying out the business you want. Section 15 of our Constitution is clear. We are also challenging the fact that Section 6 of our Constitution says that we are all equal before the law.
This afternoon, the People's United Party said in a release that the move by the Barrow administration defies logic and has political ramifications, because the government is desperately trying to protect its yet unrealized national gas company. Any savings, it says, on an invaluable commodity like butane can literally mean the difference between a family eating or not. The PUP also demands that government relaxes its stranglehold on butane entities to allow Belizeans to enjoy the benefit of price cuts in butane. On Tuesday night, the Cayo district, which has reported 3 cases of COVID-19, went under an additional lockdown. The police continue to do their rounds in other parts of the country, and the number of persons arrested and charged for offenses related to the stipulations of the state of emergency continues to dwindle. Overnight, a total of 59 persons were detained and charged for violating the regulations. And top cop Chester Williams says that the closure of businesses at 4 p.m. daily gives no excuse for persons to remain on the streets if they're not deemed essential workers.
Today, we had 59 arrests over the course of the 24 hours. So we'll be just above 500. But we're seeing a decline now in the number of arrests. I think yesterday was 70-something, and today is 59. So the arrests are going down. I hope that it is an indication that less and less persons are now on the streets. With the close of business places at 4, that will be able to give us better control in terms of persons on the streets. Once 4 o'clock strike, we'll no longer be getting excuse from people that they're going to the shop, they're going to the banks, they're going here, they're going there. 4 o'clock, everything closed. So only people who are going to be on the streets after 4 p.m. are essential workers. And those will be essential workers who will be performing some essential function. And in the absence of that, then they will not be allowed to be on the streets. So we should have better control after this.
The Kobe Foundation recently introduced a system where inmates can make virtual court appearances from the Belize Central Prison. It's a system that is also being considered by the Belize Police Department in dealing with persons who've been charged for violating the state of emergency. In keeping with social distancing protocols, it has been suggested that persons appear before the magistrate's court virtually from a location inside the respective precincts.
Well, we know that they do go to court, they get bail and go to court. I spoke to a magistrate this morning, and I could call her name, Magistrate Patricia Arana from Orange Walk. And she suggested to me to see if we can probably set up a virtual room at the police station where the persons will be able to answer to the charges from the station instead of going to the courtroom through Skype or some other means. I see it as a very good method that we may be able to look at, so as not to have that crowd going to the courtroom. After all, we're trying as best as we can to do not have a number of persons in one area gathered, and as well as to ensure that people do maintain social distance. So I think that her suggestion this morning is a good one. and it is one that we're going to explore.
The vicious beating of 77-year-old Alejandro Chavez, as well as another resident of the San Martin community in Belmopan, at the hands of police officers remains under investigation. While both victims had to seek medical attention in the wake of the incident, which occurred last Friday night, statements have not been recorded by the Professional Standards Branch. According to Commissioner of Police Chester Williams, the victims have requested that their attorneys be present whenever they are ready to give a formal account of what transpired. The men were attacked by a team of officers who reportedly entered the neighborhood sometime after 8 at night on the night of April 3rd, firing shots indiscriminately.
Professional Standard Branch had gone to record statements from the victims. The old man had asked that they return next week to get his statement. And the young man who was hospitalized, I think he had requested for them to go back either today or tomorrow. So we have still not recorded their statement as yet, and we respect how they feel. In the sense that I think the elderly guy, he said that he wanted his attorney to be present when his statement is recorded, and so we respect that. So as soon as he is ready with his attorney, he will let us know, and then the officers from Professional Standard Branch will go and record his statement. And the same thing with the other person. When he is ready, then we'll go and record the statement. But in the time being, we're not able to proceed any further because we need the statements from them.
When we come back, Stationery House is producing face shields to assist in the fight against COVID-19. All non-essential establishments are closed, and that includes businesses that sell stationery items. Although the Stationery House retail outlet on Slaughterhouse Road in Belize City is closed for Belize City and their workers sent on paid vacation, that hasn't stopped proprietor Giovanni Alamia to make use of some of his office supplies in stock. Alamia and his family are assembling face shields by hand to donate to frontline workers. Today we stopped in to find out more and share the story of this family's effort to make a difference.
With some supplies from the Stationery House retail outlet and the helping hands of his kids, Giovanni Alamia spent the past couple days making face shields for frontline workers. There are no machines involved, just office supplies and a handful of other items assembled by hand. The design is simple yet effective, and this is how Alamia and his family want to help out during these trying times. They're donating these face shields to stop the spread of COVID-19 and to help keep frontline workers safe.
The way I look at it and explain to my kids is, we're at home comfortably. The police and the doctors and the nurses out there taking care of us. So this is the least we can do for them. Just watching international news and hearing about the problems of the PPEs that the doctors and nurses are having. You're hearing about police officers dying because they're getting infected as well. So I just thought, well, we have the material here. Might as well try and make something that we could donate to them, just in case there's a need.
The face shields are designed to be easily sterilized and reused. It's safe to clean with alcohol after every use and left to air dry. The shields are also durable enough to be used for several weeks. These shields, made with transparent plastic material, are suspended in front of the user's face by an elastic headband to help stop bodily fluids, droplets from reaching the wearer's eyes, nose, or mouth. It's a secondary protection to prevent the transmission of COVID-19 when used with a primary protective gear such as a face mask.
These shields are great, but you should still wear them with a mask. They're more of a splash guard, like if someone was to sneeze in your face or cough in your direction, at least it'll stop anything from going directly into your face. But you still have the sides and you have the bottom that anything can go under, so it's best you use it with a mask. It's very visible. You can see I used the sponge foam board elastic, and I'm using the binding cover where I did 50 with the laminating covers, and I just found that it's just time consuming because you actually have to laminate the sheets. So with this, it's very easy to put on, and you have good vision all the way around. If you want, you could flip it up a little bit if you need to adjust your mask or whatever you need to adjust, which you shouldn't be touching anyway. And then you put it back down. So it's not something that's very hard to deal with.
Each one of these secondary protective gears costs roughly $8 to $10, but Alamia isn't selling them. He's donating them. Close to 100 have already been given out to frontline workers such as cops and healthcare personnel, and about 300 more are ready to be distributed.
We can't make for everyone, so it's just what we're able to make, and we give out. We're trying to spread it out as much as we can. I'm able to donate everything. Everything is coming out from my store, so that's the only overhead I have. And my kids are free labor.
Alamia has been tweaking the design to increase production of durable face shields with the right fit. He and his children have assembled as many as 150 face shields in one day. He has no plans to stop making these face shields as demands have skyrocketed in a matter of days.
Well, the final product, right now I'm on prototype number 4. Right? Initially, just using foam board, foamy, glue stick, glue gun, fasteners, elastic. So I just went step by step, trying to figure out the best way and the fastest way to make it. And I was able to get in touch with Charles Bonner from Foam Factory, and he agreed to donating some foam, and this way it speeds up the process. So at first I was doing about 30 to 40 per day, and yesterday me and my kids did 150. Well, I don't plan on stopping right now. I just continue making as much as I can throughout the day, and just every day I'll continue making. Like I said, every day I'm receiving calls about people want for their family, or police want, doctors want to purchase for nurses. And people are, I'm not selling it, but people are offering to pay because they do understand that there's a value to it. I've had a number of people call me and say, okay, how much does the material cost? We'll donate so much money for 100 masks, or 70 masks, 70 shields. So that's the way we're kind of offsetting what our part of the donation by what people are donating as well.
Reporting for News 5, I'm Andrea Polanco.
The body of 55-year-old Hubert Pipersberg, the first casualty of COVID-19 in Belize, was cremated on Monday night. The disposal of the remains of patients who succumbed to complications related to the novel coronavirus has since become a question, as it is expected that there may be other deaths associated with the pandemic locally. This afternoon on Ask the Experts, Director of Health Services Dr. Marvin Manzanero explained the procedures approved by the World Health Organization on how to deal with the burial of a COVID-19 patient.
There's specific recommendations in terms of what should be done with the cadaver of a patient who has died of COVID-19. We are not considering doing an autopsy on anybody who has a diagnosis of COVID-19. I need to say that of the bat almost immediately. We are also not considering that the body should be kept in the morgue for, not even an overnight stay. As long as the cadaver is, if you have a cadaver, then you'll have to find a means of getting it to the family, following the proper processes, and we'll probably have somebody from public health come and explain all that means for the family. There's two things that I think we need to be aware of, and we need to be very, very clear on that. Understand that somebody who is critically ill, has a COVID-19 situation, is not going to be allowed any visitation. Even the two patients, both in Corozal and Karl Huchner, visitors are not allowed. So you're not going to necessarily be seeing your family members.
Coming up after the break, we'll tell you about another drought on the horizon.
A port with a global perspective.
Social activist Moses Self is weighing in on the state of emergency and how it adversely affects the entire population of Belizeans who are living below the poverty line. While there are strict rules to abide by, including a nightly curfew over a 30-day period, Sulf, a member of Belize Leaders for Social Justice, strongly suggests that government should lock down the entire country for the next 4 weeks. The catch, however, is that an entire month's worth of provisions should be made available to these families, notwithstanding existing programs such as Boost and the Pantry that government already has in place.
We're of the opinion that there should, or the suggestion humbly, that there should be a total shutdown. There should be a total shutdown whereby nothing is being done 24 hours for 4 weeks. But in order for this to happen in a positive way and have the outcome is supposed to have, it that the government will need to pool together its resources and provide 4 weeks supply of groceries for all needy households who have no access to that amount of groceries that will serve them for that period of time. What you will do in this, when you have a total shutdown, you will curtail the transmission. You will stop the transmission, you will stop the spread, you understand? And it will only be limited to those who have already contracted the coronavirus. And then the authorities can then map out and identify the houses that are coronavirus infected, and then we won't have additional spread. What informed that position? The amount of people who have still not gotten anything, the amount of people who I meet on a daily basis who has to be out in the street trying to see how they can get that 1 day supply of food just for that day. And the Boost program, my brother, before this pandemic, it has never been reaching most of the people who need it anyway. There were thousands of people who were never benefiting from the Boost program.
Is another drought on our horizon? That's what it's shaping up to be, according to the National Meteorological Service's seasonal rainfall forecast for April to September. That forecast shows there may be a drier than usual condition, which could mean a drought across most of the country. The Met Service cites the El Niño Southern Oscillation as one of the main climatic drivers for this. The release points out, quote, whenever there is an El Niño, as was the case in 2019, there is high confidence that our region will see less than normal rainfall. However, for this year, the ENSO is expected to remain in a neutral phase for the coming months. This creates greater uncertainty in the seasonal forecasts, unquote. While the country still hasn't recovered from last year's drought, the Met Service has issued a drought warning for the districts of Corozal, Orange Walk, Cayo, Belize, and Stann Creek, and a drought watch for the Toledo district. Climatologist Michelle Smith-Augustin tells us what you can expect and how to prepare.
From April right through to September, we expect drier than usual conditions across much of the country.
And when we say drier conditions, does this mean that there will be a drought?
Yes, all indications to us so far have suggested that a drought is possible again this year.
Now, what areas are we looking at to be perhaps hit the hardest as a result of that drought?
The driest conditions are expected over northern and central areas of the country, and that includes the Corozal and Orange Walk district, the Cayo district, and the Belize district.
What industries are perhaps going to be most affected? We usually tend to focus on the agricultural industry.
Yes, that industry is the industry that we expect to be affected greatly by this year's drought. We expect similar conditions to last year, so whatever losses the agriculture sector experienced last year, we expect to occur again this year.
Right. Now, what can these people do to prepare for something like this?
All right. They can ensure, first of all, that they have adequate water supply, and that would entail conserving water as early as possible. As soon as the forecast is released, it is advisable that they conserve water as much as possible.
Now, when we say conserve, are we saying maybe use less, or are we saying, store some water?
Exactly. We expect them to at least try to implement some kind of water storage system to anticipate the drier months that we expect ahead.
What is really maybe causing this again for us to experience another year of drought conditions?
All right. Well, from last year's drought, the country simply didn't recover. Water reservoirs, groundwater and surface water reservoirs remain low from last year's drought, and so a decrease in this year's rainfall, both in the actual observed rainfall and the forecast rainfall, we expect the drought condition to reoccur.
Based on information that you guys have, are you able to say if at this point we will see a difference between the drought of last year and this year's?
All right. At this point, it's really hard to say whether or not it will be worse than last year's drought, but it could be, or the belief here is that it could be as bad as last year's drought.
The Met Service says that an increase in pests, diseases, and sporadic fire outbreaks associated with these drier conditions are also likely. The public is reminded that monthly updates to the drought forecast are available on the National Meteorological Service's website. And that's the news. Don't forget that tonight's broadcast is available in both text and streaming video at channel5belize.com. You can also connect with us on our Facebook page at facebook.com/News5Live. I'm Marlene Cuellar. Thanks for joining us. And from all of us here at News 5, please remember to wash your hands, keep your social distance, and stay home. Good night.